Good morning, good afternoon, good evening, good night, wherever you are in the world. A very warm welcome to this seminar on education continuity, school operations, and the COVID-19 pandemic, learning from the US and Canada, brought to you by the Consortium of Universities for Global Health, of which I am a board member. My name is Gavin Yamey, and I am a professor of global health and public policy at Duke University, where I direct the Center for Policy Impact in Global Health, a policy lab that works on kind of big picture strategic questions in global health. And today we are going to talk about schools and COVID-19, a very non-controversial topic. Just kidding. So I'm not a school health expert, and so you may be wondering what on earth I'm doing moderating this. It's a good question. Thanks for asking it. I am more of an interested observer in public health and in global public health. I have written a little bit on schools and universities. I did a piece with Rochelle Walensky from CDC on university reopening, and actually a piece with one of our panelists, Patrice Srivastava, on mitigations, but really I'm more of an interested observer. We've got remarkable experts who I will introduce shortly from across the health and education sectors. And perhaps more importantly, I'm a dad to a 5-year-old who actually has experienced the full range of modalities this year, in-person, hybrid, and online. I want to just quickly set the scene before I introduce the panel. Obviously, as you all know, COVID-19 has been a global multi-sectoral crisis. I've been working on the health side, particularly around vaccines and vaccine equity, but it's clearly also a food crisis, a supply chain crisis, an unemployment crisis, and an education crisis. The focus of today, and schools and colleges and universities have tried to maintain education continuity through a variety of approaches with varying outcomes. And today we're going to dig into the issues and the strategies that need to be taken into consideration for continuity, for sustainable reopening of schools. How can schools offer safer in-person learning without these recurrent outbreaks that then obviously disrupt education again? So we're going to hear from experts who've been very much at the forefront of policy research, evaluation, and implementation. And very interestingly, I think at the local, regional, national, and international levels. And we're also going to hear, I think, very compelling, very interesting, contrasting case studies from Vermont and Ontario that had quite different approaches, I would say, to education continuity. Let me briefly introduce our remarkable panelists. Their full bios are online. I'm really keen to hear from them soon. So briefly, we have Sarah Lee, a health scientist from CDC, from the Healthy Schools in the Division of Population Health. Dr. Lee developed the CDC guidelines on schools and COVID and has expertise in school-based public health, research, evaluation, and policy. We have Libby Bonesteel, superintendent of the Montpelier-Roxbury Public School District in Vermont. She has been described, and I quote verbatim, as a real force in keeping schools safe during the pandemic through a community-based approach that we're going to hear about shortly. And Sostin, policy fellow at the Nelson A. Rockefeller Center at Dartmouth College, a public health practitioner, researcher, and educator who has a passion and a focus on health equity globally, as well as in rural northern New England. And Patrice Srivastava, who is a tenured associate professor of education and international development in the Faculty of Education at the University of Western Ontario. She specializes in education and global development and has worked extensively without much sleep. Indeed, all panelists have had virtually no sleep during this pandemic on the global education emergency caused by COVID-19. Welcome one, welcome all, and welcome to the 100 or so attendees from around the world. Really so happy that you've joined us. Looking forward to your questions. There is a question box. We're going to chat to the panelists for about 40 minutes or so, and then a 20-minute Q&A, which I will moderate. And I would like to start with Sarah Lee. If you could kick us off today and tell us about CDC's guidance on COVID in schools. How were these guidelines developed and how have they evolved over the course of the pandemic?
Great. Well, thank you so much. I'm so happy to be here with all these other fantastic panelists. I'm excited to hear from everyone else and get questions from the participants. This is such an important, critical topic when we discuss schools. Of course, that's where I've lived my career, is within and working with schools. So they're a really critical infrastructure of communities. As you said, providing safe and supportive learning environments for students and employing millions of teachers and other staff around the globe. So really, really happy to be here with everyone. I have just a few slides, Gavin, to cover kind of as a backdrop for our discussion today. So that first slide you see up really highlights in a very simple way this ever-evolving process that CDC has really used to continue to update guidance. And, first the guidance was developed, as you mentioned, I've been really involved with the guidance for schools along with many other fantastic colleagues at CDC, but also in collaboration with a lot of partners, hearing from those who are in schools or working with schools to help us understand questions that they have and concerns that they had and the reality of what they were facing. So that was a really important piece of this. So that first bubble at the top, it really just shows guidance is developed in the first place. And we developed guidance back in February and March of 2020 for schools and has kept evolving, as you said, over the course of the pandemic. And at the core, it's always relying on the best available science at that point and best practice as well. So learning as we go, literally, when things are being implemented and decisions are being made, along with the most critical science available. Moving from that is then watching and assessing and evaluating the adoption and implementation of the guidance that happened within schools, particularly this school year, because as in many places, all of our schools were essentially closed last spring when the pandemic hit. And so it was a constant reassessment and evaluation of the science to then see how it was being implemented in real time and knowing what the barriers were, as well as what were the best prevention or mitigation measures at different points in time? What could we learn from mitigation that was being implemented that we had recommended in the guidance? So we've then gone back a few times based on published studies, based on field studies that both CDC and university partners and others across the U.S. and other countries implemented, and looking at those results to then refine and update the guidance. So that really explains, like I said, in a very short, hopefully succinct way, how the guidance development process occurs, and we continue to do that. If we can jump to the next slide, I'm going to just jump in really high level, Gavin, about what our guidance, where the guidance is at right now. At least the latest update that we released in March of 2021 was much more of an operational strategy, reflecting current guidance on, current evidence rather, on what we knew about COVID-19 transmission among children and adolescents, and what we knew about transmission in schools. That was summarized in a science brief that was at the same time released with the operational strategy. So the operational strategy was really presented as a pathway to open schools for in-person instruction and help them remain open through the consistent use of prevention strategies. And it was really meant to give decision makers a sense of what we call kind of this integrated package of tools and resources and data to help data-driven decision making. This, I just want to cover really briefly, is a highlight of what we call the essential elements of safe in-person learning. First is to take into account indicators of community transmission to reflect the level of risk. And we really looked at that as across a spectrum of 4 levels from low to substantial and high. Then taking that into account, presented this phased reopening process. Like how do you kind of calibrate these mitigation measures at the different levels of community transmission, and how might that also inform decision-making related to modes of learning? As you mentioned, your child has been through all of them, in person, fully virtual, and hybrid. So what would that look like, and how do we use data and the science to drive decisions about mode of learning as well? And then really at the heart of the guidance that we've presented is this set of layered prevention strategies, which I'll highlight very briefly on the next slide, to really focus on just reducing risk of transmission in schools. The other piece that we added, because more science was available, and of course then the vaccine became available, and there was a really large national federal initiative for teachers and school staff in March, as I'm sure many on the webinar are aware. We added the testing and the vaccination piece. So testing to identify individuals, particularly those with potentially asymptomatic infection, and then the vaccine promotion and accessibility. Next slide, I'm just going to jump into a little more detail about the prevention strategies that were recommended within the operational strategy document itself. So we stress the use of and layering of 5 key prevention strategies: universal and correct use of masks, physical distancing, which initially we had 6 feet, and then the update based again on several studies that had looked at actual distance, shifted that particularly in a classroom setting with some exceptions, moving it to 6 feet, but primarily focused on the 3-foot distance. Hand washing and respiratory etiquette, so again, teaching it and reinforcing it. Cleaning and maintenance of healthy facilities, which is where ventilation falls within that category. And then contact tracing in combination then with isolation and quarantine. So the other thing that we stressed is when we looked at the studies that had been done, we had heard from so many partners in the field and other university researchers. What were we seeing as because one of the questions we got, and I'm sure many folks will talk about this, I'm very, very excited to hear from Libby and how her school district went about implementation, was these 2 prevention priorities of masking and distancing were really elevated. It doesn't mean not to do the other prevention strategies, but those 2 must be at the core of those layered prevention strategies. And we learned that from the science the further we got into the pandemic. And it's just one of those questions we receive from a lot of school decision makers. Well, what if we can't do all of these things? Which ones are the most critical, most important? So we did highlight those as the 2 prevention priorities. So those are the last of my slides, and gives you really kind of like high-level overview of how we develop guidance, how we assess implementation and adoption, and how we then refine guidance, and we continue to do that. Just to share with everyone, in the coming weeks, we will be updating that guidance again, given that we have updated guidance about what fully vaccinated individuals can do, and how that comes into play in a school setting. So the guidance for the 2021 and 22 school year will reflect the updates about that are in the fully vaccinated individuals guidance, and also continue to take into account where we are in the pandemic at this point in time with level of transmission within communities. So I'm going to stop there and turn it back to you if you have any immediate questions for me. Thank you.
Thank you so much, Sarah. I mean, our kid did 4 days a week in person 4 months ago here in Durham at a public school, pre-K, with every single thing you mentioned, actually: masks, pods, distancing, testing every 2 weeks, PCR, vaccinated teachers, symptom screening, 0 cases in 4 months. So I think a really good success story. I know that's N=1 school, but I know of other schools that have had similar outcomes. One quick question, which is, in some ways, we are beginning, hopefully, to start thinking about a sort of a recovery period now. And I believe there's a task force on recovery that's working with the Department of Education. Can you briefly tell us a little bit about that?
Sure, it's such a good question and a really, really important one, because I agree, right? There's this optimism that we are heading more toward recovery than anything else soon. And there is a larger effort in the federal government and toward recovery that involves multiple agencies to really address the impact that it had not just on health and the healthcare system and the public health system, but all other aspects of society. What I want to share with you about that is hone in on just one slice of that is specific to schools, and it's not all encompassing of what will be done with schools. CDC is consistently collaborating with the U.S. Department of Education, as well as other federal agencies like the U.S. Department of Agriculture and SAMHSA, which is the Substance Abuse and Mental Health Agency, to really look at what supports need to be in place from a state down to a local level to address, kind of front and center. Honestly, one of the biggest pieces is the social, emotional, and mental health of students and school employees and staff. This is what we have heard over and over and over throughout the entire pandemic, is how deep that need is. And so at CDC, we are providing funding to support state and local education agencies to be able to address those needs in various ways, whether it's through training, it's technical assistance, direct funding, curriculum, and other new programs and practices to address those needs. We're also, like I said, working closely with Department of Education, which has just been fantastic, because it's helping us really hear from the education world what questions they have, what needs they have. And another piece of this kind of puzzle in the recovery that we're involved in is reaching parents and hearing what their needs and concerns are, and also helping create information and materials, resources that can help parents make informed decisions, and whether it be about their child being in school, whether it's about vaccination, it's about testing. So those are some of those activities, again, more high level, but to give you a sense of where things are moving. I think that helps paint a bit of the picture for schools.
Fantastic. There's some brilliant questions coming in, but we're going to hold those on variants, on ventilation, on vaccination. So many great questions. Libby, when we think about Vermont, there's this famous saying, right? They close the bars so schools can stay open. Can you share with us your experience of in-person schooling? And I know that you that there was a real community effort involved. Share with us that experience.
There was a real community effort involved. So in Vermont, our state leaders did an amazing job, especially early on what the messaging to the community in the state. We had press conferences every other day in the start of this to give updates and to give just the "we're all in this together" speech. It was a constant refrain in Vermont from our state leaders, and they did a really nice job with that. People tuned in. It was high quality viewing to those press conferences every other day, which I don't know if the governor can ever say that or will ever be able to say that in the future. So that piece was huge here. The other piece that was big in the very beginning was that our state agency of education worked incredibly closely with our state Department of Health to create guidelines. It was about an 80-page document when it first came at us, and while schools would have liked that a whole lot sooner than when we actually got it, it was a very readable set of guidelines that we all had to follow. Now the difference is that every one of our schools in the state have a different setup, have a different building configuration, and so following those guidelines were very school and district dependent. Some went at it from a regional perspective. So my colleagues in Champlain Valley, which is where Burlington is located in more northern Vermont, all went at it as, we're going to do a similar thing together. So our kids in the region have the same hybrid schedule. That's what my kids experienced. But here in central Vermont, we really looked at the guidance and we helped each other through it as superintendents, but then we had to look at our buildings and say, what exactly could we do? So when I think about our experience in the very beginning, the very first thing we did when we got that guidance was to measure our classrooms to find out exactly how many kids we could fit in a classroom safely with the distancing requirements, which was 6 feet in the very beginning. And so we did that, and we found that we could fit every one of our elementary school students into our classrooms with 6 feet of distancing. And we had to figure out some desk configurations and furniture challenges, but we could do that. And so once we knew that our middle school students, we could do it in most of our classrooms. But then we measured our cafeteria and we said, well, we can get a classroom in this cafeteria. And we measured the gym and we could get a classroom in the gym. So we have had kids in cafeterias and gyms all year long as they're distanced and spaced. At our high school, we couldn't do that. So our high school, we knew that a priority was to have kids in school every single day at the high school so that we had our eyes and ears with them. And so the high school designed a quarter system where the kids only took 2 classes a quarter for a much longer period of time. And there was an AM class and a PM class, so that kids did have school every single day in high school and went deeper into the content with a 2.5-hour block, which proved to be enormously successful for our learners. We had a 97% proficiency rate at high school this year on our coursework and our priority standards. So we had some big time success with that model, despite the challenges. But from a state down to the school systems, we all had this mentality that we are in this together. We asked our state very hard questions and they came back with some answers for us most of the time. Not all the time, but most of the time. So some key strategies we employed, we did use a pod model. So in our K-8 classrooms, every classroom at kindergarten through 8th grade and including pre-K had 2 teachers and at least 2 teachers in it. So, or a teacher and an instructional assistant. So how we did that is that we said that our specials, our art, music, PE was going to be remote. That would all be virtual, and our PE teachers were now 3rd grade teachers as well. So our French teacher is now a math and science 8th grade teacher. So we did that pod model, kindergarten through 8th grade. That turned out to be enormously successful because we didn't have to deal with substitutes. So when one of those individuals was out sick or for whatever reason, we had another individual who knew that class. And then we paired pods. So if it happened that both pod teachers were out, then we paired them with another pod to have that teacher, one of those teachers, come over. I think that happened maybe twice. We had a very low absentee rate throughout this entire thing, which is interesting. I think a little peer pressure and colleagueship was in play there. We had our masking and our distancing, as I already said. We were worried about middle school kids in particular wearing those masks. We did not have a problem with it. It was a community expectation. And there were points during this year that I can honestly say people did, if you didn't have a mask on, then it would have been very odd in Vermont if you didn't wear a mask in public. You would have been a significant outlier. That was just a community response, and the kids responded as well. We had maybe 2 instances in the beginning of the year where we were like, wear a mask, you're not coming to school. And that was it. And from that point forward, we were fine with that piece. We did begin a virtual school for K-6, for our kindergarten through 6th graders through our own system. My curriculum director was now the principal of our virtual school. So we did offer up the option for virtual learning. We consulted with an outside company called Vermont Virtual Learning Collaborative for our 7th through 12th graders. So that was more of a statewide response piece. So we did have approximately 175 kids in our virtual learning piece. Kids were eating in classrooms. Our in-person kids were eating in their classrooms because our cafeterias were used for other things. We had significantly different cleaning protocols. However, once we learned that this was an airborne piece, the cleaning protocols played a little bit less of a role, but certainly in the beginning, it was more of a mental support for our adults and our families in terms of what our cleaning protocols were. All our specials were remote. We had a shorter day for our kindergarten through 8th graders. They were in a mask all day long. Our buildings can be hot even in Vermont in September, and certainly now. So we had a shorter day for our kindergarten through 8th graders. We did constant communication. And one of the pieces that I know worked well was when we got messaging from the Department of Health, the superintendents and principals across the state reiterated that message over and over. There was no question of it. It was constant. So we really saw our role as supporting the Department of Health at getting this message out Principals in particular are kind of like priests and clergy in communities. You know, their word means a lot to families, so we know that. So we had some very intentional communication. So those were some of the key strategies that we had to get through this year. We had serious challenges, as everybody did, despite our successes. Beginning a kindergarten through 6 virtual academy from scratch is not an easy thing to do. That's completely new. We had to train our teachers very quickly and how to do that and how to do that well. We also, I promised and guaranteed our staff that I would provide an accommodation to any staff who was medically fragile towards COVID-19. And there were moments where my head was down on the desk and tears were flowing as I was talking to staff, listening to how scared they were to come into the classroom. But we figured out an accommodation for every single one of them. When we were Vermont was at the highest points in case counts, schools did contact tracing. So on Christmas Eve, I was calling families, telling them that they needed to quarantine for the next 2 weeks and could not, no, you can't see family because your kid was a close contact. Contact tracing was difficult. When one case happened, there was one point where we had 3 cases at our high school, and the school, we were responsible for calling about 200 students to tell them that they had to quarantine. So there were definitely moments like that. And then there's shifting guidance. You know, this was a pandemic. Nobody had been through that before. So guidance certainly shifted, and there were a lot of unanswered questions, and sometimes you just need to do, right? So, unsure of what our decision was, a right decision or a wrong decision, but you just got to get through it. I'd say those were the biggest challenges to this. But other than that, we had a pretty successful year here.
Brilliant. I have a million follow-up questions, but I'm actually going to hold them, Libby, because I'm conscious of the time and I want to get to some Q&A later.
Perfect.
Yeah, I'm quite active on Twitter, and I tell you, the thing that I get the most negative responses to from around the world is if I talk about masking on kids. I think our kid has worn a mask for a year without problem. His friends have as well. I think kids have adapted very well indeed, to be honest. But it's interesting how emotive a topic that is, particularly in some other countries. I want to pass to Anne, who has been has written a lot and talked a lot about the role of schools as actors in the broader public health response. Tell us about that, the role of schools as public health actors. And you are muted. Someone is always muted. It's usually me, so I'm delighted it's not me this time.
Thank you, Gavin, and hello, everyone. I want to just begin by providing a little bit of background on how I came to thinking about the questions of school. For the last year, I've been co-leading research on COVID-19 and rural health equity in our northern New England region. Our research has focused on the response of the pandemic in New Hampshire and Vermont, and we've sought through interviews with key stakeholders across the region to understand the impacts of the pandemic on our rural communities and health systems. It wasn't our objective in the beginning of this work to look at the school reopening process. However, our attention shifted to the roles of schools in the public health response and the impacts of the public health response on schools as it became clear that this was a key issue for our rural states. So I want to just comment briefly on the roles of schools in the public health response, as well as the public health response in thinking about broader questions of both health and educational equity. Much of what I will say will echo Libby's comments on her experience as a school leader, but I really want to think about what we can learn as a public health community and carry forward as we look ahead. As Libby noted, schools in Vermont reopened amid the lowest case counts in the U.S. Schools emerged very early on as key health actors in the public health response. School leaders served as key public health messengers and called upon their communities to adhere to public health measures. They asked their communities not only to maintain the measures in place at schools, but also the restrictions that had been put in place to maintain low levels of community transmission. In late fall, cases began to rise both in the state of New Hampshire and in Vermont. At that point, the state rapidly instituted further restrictions to suppress community transmission. It closed bars, it restricted social gatherings, and for a very brief period of time, it instituted a restriction on masked walks with a friend outside. Many at the time questioned what the state was doing. However, the state had identified maintaining in-person education as one of the key goals of the public health response. And as we saw, and as Libby commented early, with the schools aligned their own activities with this response again. What we saw in our communities was that many families canceled their social plans and holiday plans. And this really highlighted the value that many place in schools and the role of schools in maintaining community transmission. I think there's been a great deal of debate at national level around whether the role of schools in driving community transmission in Vermont, and our lived experience in Vermont would suggest that that schools have a key role to play in maintaining low community transmission and serving as key public health actors. Central to this work has been partnership. Libby spoke to that in describing the close collaboration that existed between the Agency of Education and Department of Health, between the Department of Health and schools, and between schools and communities. And we've seen this across the state of Vermont in our work. We have often observed communication between agencies and between communities and thinking about how do we address the key challenges, and there were many in responding to the pandemic over the period of several months. I want to speak briefly about some of the lessons that come out of this work, and I'm sure that there will be questions in the follow-up period. First of all, I think it's really important for us to think about the ways in which our experience in Vermont disrupts this narrative that education and health equity are somehow in tension with one another. Vermont has helped us to think about how we can advance these dual objectives together. We've seen in Vermont that communities play a central role in health and education. Often in public health, we talk about the social determinants of health. Our experience in Vermont would suggest that we might begin to think about the social determinants of education and the ways that we can move health and educational equity forward as we look beyond the pandemic. We've seen schools play a role as critical public health actors. They've been central to the community response. And we know as we come out of the pandemic, there's an opportunity to think about what role can schools play in addressing other challenges across our communities. Another lesson that comes out of our experience in Vermont is the alignment of our public health response with our policy goals. Vermont instituted restrictions, it closed other activities with the explicit goal of maintaining in-person education. As we look to future pandemic preparedness work, as we think about other challenges, we need to consider what role our public health response can play in achieving the goals that we set forward beyond the health sector. We've also seen the ways in our state in which partnerships between the public health and education community have been really critical, and see a significant opportunity for discussions across sectors as we come out of the pandemic. Finally, I just want to say that future planning needs to consider how to resource schools to fulfill public health functions. What I'm not advocating for is that schools take on another unfunded mandate or that more be asked of them without resources, but rather that we think very broadly about the resources that they need to carry out some of these activities, as well as the things that they've often been doing with very limited support. So I want to conclude there, and I will let you follow up with questions that you have.
Brilliant. I am going to hold questions for you and Libby, partly about trade-offs and partly about how education and health can work better together. But I'm going to move on to Prachi and then bring you all in on some really juicy questions. There are so many that are coming in around the fall, around where vaccinations fit in, around where new variants might fit in, around funding. This unfunded mandate question, Anne, comes up a lot. But I want to hear from Prachi first. I know that Ontario's experience has been rather different, and from what I understand, you've had one of the longest school closures in North America and perhaps the world, you even said, like one of the longest in the world. So it's a different case study, it's a different story. There are going to be lessons from your story, and I would love to hear what your experience has been.
Thank you. Thank you to all the other panelists. Gavin, how many minutes do I have? Because I usually talk a lot.
About 6. How about that?
Okay, great.
Because that will give us about 20-ish minutes,
Lovely.
15-ish minutes for some of the.
No worries.
We've got so many great questions. I hope we can get a few of them in.
So I'm gonna preface everything by saying that you know, I'm part of there was a brief that was commissioned by the Ontario Science Table, which is an independent group of scientists and researchers, and this brief looked at school closures and education disruption in Ontario. It was released earlier last week, and that can be downloaded. And the other part of the story is that I also developed a dashboard that connected all school cases in Ontario with the equity kind of indicators on affected schools and what the social background characteristics are of those schools. And you can go to COVID-19schooldashboard.com to get some of those data. So those are two things that viewers might want to look at. In terms of contrasting cases between Vermont and Ontario, you know, we do have education continuity. It's not that there's no provision. And we have had similar kinds of provision in terms of emergency remote virtual instruction, which has been put in every time there have been mass closures or localized closures. And from September to December, it was relatively open. There were some localized closures, but it was relatively open with some of the safety protocols that were already introduced earlier. In terms of masking, in terms of some of the cleaning protocols. Some school boards had put in ventilation, but one of the #1 things that we were looking for was to have smaller class sizes, and so that we could actually do the distancing better, and that was not funded. So those are some of the things that happened. From January onwards, we've had protracted school closures in Ontario, and that's primarily because our province has seen up until very recently the very highest numbers of cases. And so again, the whole question is around community transmission and what were the macro measures that were put into place in order to allow schools to continue. In the case of Ontario, the macro measures that we might want to see were less stringent. And so schools were really used almost as a lever to try and control some of that transmission, but that wasn't a very, in my estimation, not a very effective lever when you compare the neighboring province of Quebec that had very similar case numbers, but they actually protected education and closed other things and introduced vaccination prioritization and a whole host of other measures in terms of the community level. So yes, well, now when we look at our situation in Ontario, we are roughly, the Premier made an announcement last week that the schools will remain closed to face-to-face instruction until the end of June, which is the end of our school year. And at that point, we'll be around 26 to 27 weeks of school closures since March 2020. That does rival the global average if you look at the UNESCO figures, and it by far exceeds, well, maybe not by far, but quite significantly exceeds what we're seeing in the rest of Canada. And it's about 3 times longer than Quebec, the neighboring province, again, which had very high case counts and is suffering the same kind of issues around the new Delta variant and all of this. So I think the issue really here is, you know, when we talk about schools and we talk about the question around schools and education disruption, we want to look at a number of issues. The first is, what are the macro measures that are put into place? And are schools really treated as an essential service? And by essential service, then you would have to treat that quite explicitly the way that you would, for example, to keep the healthcare sector open, right? You wouldn't want to close hospitals. We would put in all these measures in terms of looking at the macro measures. So what else can we close? What else can we close more longer term and perhaps subsidize some of those areas? We know that there are certain governments like Germany and Scotland that subsidized other sectors in order for other parts of the society to remain open. So that's the first question. The second question is, what are the school level mitigation measures? And I think the panelists today really cover a lot of school level mitigation measures. The ventilation question is significant. The question around smaller class sizes as a public health measure is significant, and that does require extra resourcing. And resourcing is the #1 issue that we're seeing globally. All of the global organizations, including the World Bank, the T20 and the G20 for whom I consult, the UNESCO, all of these have said that we need to protect our budgets and we need to actually boost resources. That's the second part of the story. And the third part of the story are, what are the supports that are being put in place directly at the household and at the community level, particularly for those communities that have been worse affected, but were the most affected by the other consequences of COVID, and in terms of how that interacts with the schools. So schools are often a hub of other services. It's particularly for children with special needs, particularly for children coming from more disadvantaged socioeconomic backgrounds, nutrition, therapies, diagnostic and counseling support services. What is being put into place? As we go into September, there's a big slogan in Ontario around Safe September, and Safe September was part of again an activist kind of group, not a group, but like an online kind of activist, hashtag that developed last year, so 2020, and sadly we're having to do it again in 2021. But it really was looking at much more of the school level public health measures that were addressed today on today's panel. But I'm saying that for recovery, those are necessary measures. They're necessary but not sufficient. So what we need is a much broader context where we have the public health measures to make our buildings safe so that they actually remain open. And again, that's connected to those three community measures, school level and household level measures. But then you also need adapted and extensive curricular reform. When we come out of education and emergency, this is my last point, there are usually three things that we want to look at. The first thing is to have broad-based adapted curriculum reform, especially in contexts like Ontario, where we've had extended school disruptions. And what you want to look at is to look at the curriculum and see what parts of the curriculum you might need to shuffle into the next year, what part of the curriculum you need to lengthen, what part of the curriculum you want to maybe bring in from the previous year, and you do that for every grade. The second part of it is to boost core skills in all grades, but also to introduce psychosocial programming and psychosocial support for all the children, because we know that there have been adverse effects, especially around mental health and emotional skills. And the third, final part of that is to really emphasize and boost targeted initiatives that require maybe accelerated programming or different kinds of programming for the most vulnerable, who experience new vulnerabilities and who also are coming into the pandemic with existing vulnerabilities. So we need to kind of have that discussion around public health and education, and how do we actually look at education continuity and education recovery in a much more holistic way.
Thank you very much, Prachi. That was really helpful. And we've got 15 minutes now for Q&A, and I'm going to try and bring everybody into the panel. Maybe all four panelists could put their videos back on. There are so many questions. I'm going to try and just distill out a few. And actually, I'm going to come back to you, Prachi, in a minute. But Libby and Anne, I want to come back to you first of all. Actually, this is a comment that I just have to share from Emily. I hope she won't mind. Emily Lute, who is an employee of the Vermont Agency of Education, and just says amazingly grateful for leadership and teachers in the district. That's a nice segue to the two of you, which is around Libby. I mean, education hasn't been normal with the mask. There have been trade-offs. What would you say have been the biggest trade-offs? I've had a few questions about the trade-offs in the Q&A here.
Yeah, certainly the trade-offs were, our specials. Our kids haven't had a PE class all year, and that's important, or an art class in person. So those kind of things are very important. I think we have a huge community involvement in Montpelier and Roxbury. Our buildings are the centerpieces of the community, and they've been closed. So there's been some drawbacks from the community knowing our buildings and what's happening in our buildings. I think that also I worry most, quite honestly, about our adolescents who are not athletes. In Vermont, we got athletics to happen for the most part. And so our adolescent kids who aren't in that athletic field, and I'm speaking as a parent and as a superintendent here, there were some missing pieces. There wasn't a whole lot for my son to do during this time, so he spent a whole lot of time in his room, which may be normal for a 13-year-old. However, I think he needs a little bit more social development than what he got this year. I think, and then just relationship building in general, right? So it's really tough for kids to build relationships when you're saying, stay apart, don't touch each other. I mean, kids touch each other, that's what they do, right? And so you're missing a same recess feeling or a same cafeteria-like feeling between kids and play dates. You know, they just didn't happen this year. So there's a relationship piece that kids missed out at. There were some trade-offs there to keep kids safe, kids in the community in general safe. And I think kids are resilient and they'll get back to that piece, right? But that was a major trade-off that we made this year.
I wanted to ask Anne maybe about, look, I'm just going to say it, there have been tensions between the health community and the education community. You know, there have been times when teachers have got blamed, you know, from the public health folks saying, damn these teachers, or teachers unions or whatever. What do you make of that? And what do you think we can do better in the future about having these sectors be on the same page? Maybe I'll open that to everybody, actually.
Yeah, I think that Vermont highlights that when we work in partnership across sectors, that we can get schools open, or we can work towards other goals. And so I think one of the key lessons to come out of here is the need for partnerships, for listening across sectors. I've had the great privilege in my own work of spending a lot of time talking to school leaders and teachers and really trying to understand what their concerns are, what the challenges are, and thinking with them at times about some approaches to addressing them. And so I would hope that we would recognize the importance of really listening as we go forward. I think that many in Vermont have done that very well. There's been a sense of collegiality across communities that's been as important as any of the guidance or measures in place. It's that sense of community and that we're all in this together that's really helped carry the state forward through this year.
There's actually a comment from Irene Torres, my colleague. We just recently wrote a piece together where she says health promotion values can be a form of democratic empowerment and critical thinking. What do you make of that? I mean, sure, I agree. So there are a lot of questions. I'm going to roll them into a few big ones. Maybe to Sarah. Some of the variants of concern that appear to be more transmissible Delta. How do they, you know, affect the equation? Do they? Should they? What do they mean for schools and so on? That's a big question from lots of different people. And I would say that along with that question is another question about or lots of concerns that mitigations in schools are ending, perhaps prematurely. And there's a comment from someone in London whose school is doing none at all and is very worried. What are your thoughts about all of the above? I know that's a lot, but
you did roll them into a few big things, Gavin. Okay, so the first one, actually, I'll take the second question about stopping. And I know not everyone on this call will be familiar with it. We did make a statement, goodness, I guess it was a few weeks ago now, that really said, try to keep these mitigation measures in place through the end of the school year. That's really CDC's recommendation. These remain critical, particularly when we're speaking about school children being in a large group of not fully vaccinated individuals. Even those 12 and above who have access and are eligible, most of them won't be able to get fully vaccinated until, you know, if they got it the first few days, it's not until the end of June. So most of them, I know many schools in the US are still open, but a lot of students through the end of the school year won't be fully vaccinated. So that's something that's really important, and why we stressed continuing to do the mitigation measures and not just, you know, to set them aside or lessen them is really important. The second piece, I'm now forgetting your question about, the variants. Yeah, I mean, this is absolutely something to take into consideration. And it really, I would go back to how we continually at CDC, and just in terms of writing and refining guidance will continue to take those into account, along with all of the other evidence we see. So I don't know if it was Anne or Libby that said, actually probably all three of you said, you know, the challenge is everything is new, even still, you know, within the pandemic, we're continuing to learn every day. And so as we learn more about the variants and what that means on vaccines and what that means about community transmission, the guidance has to be, you know, flexible in a sense to say, okay, we're saying this now because at this point in the pandemic, these are the things we recommend. But if new variants come into play and they are having a big impact on transmission, that has to have a shift in guidance. So we definitely take that into account, along with the other science that continues to be evolving around the topic.
Anyone else want to come in on that? Yes, Prechi.
Can I come in on that? Thank you,
yes,
Sarah.
Please do.
The discussion is fascinating because we have such different disciplines coming together and practices coming together. And I think that part of it is certainly new for the U.S. and Canada. It's not new for the rest of the world. It's certainly not new for pandemic affected countries that were affected by Ebola and Zika in particular. And it's not new for low and low middle income countries that have to de facto build education sector plans and health sector plans in tandem, because in a certain level, they're somewhat forced to by the global architecture in terms of how they're financed. But I do think that for countries, many of the G7 countries, and particularly for the US and Canada, and in Canada, we don't have a federal Department of Education the way that you have in the US. It's all done provincially, and then our Indigenous communities have governance and self-control as well. So, you know, there are different governance structures, and a lot of this, because we've been in the fortunate situations, both of our countries, to be relatively stable. I say that, you know, but when we compare to other countries, we've been relatively stable and we've had high resources. We're not used to thinking about crises. And I think that's why for us, especially in education and in health, when we're not used to it, a lot of these conversations around the social determinants of health and the social determinants of education, they're not new. I mean, I think Gavin and I, you know, we work in global health and global education. So, you know, that's pretty important practice. I think one of the issues, though, is the scientific knowledge around the mutations and the evolution of the virus certainly is new. How to protect and promote education in terms of education emergency provision, education emergency delivery, education emergency recovery, that literature is actually quite substantial now. I think the sadness for me, it's at least for the last 20, 25 years, and we have lessons from Ebola, we have lessons really how to deliver in that context, mass education. The sadness for me has been that a lot of those expertise and a lot of those discussions in our discourse have not been incorporated in a way, firstly, because of our structures, our governance structures being quite siloed, and secondly, because I can only speak for Canada. I think we're quite parochial in our mindset in terms of learning from countries that seem to be in a situation that is more fragile than us for years. We haven't actually incorporated those expertise, and I think as a result, we've suffered much longer and to a greater extent than we had to. So, you know, I think that's, and I would love to speak with you more after, because I think we have so much that we learn from each other.
This has been one of my bugbears throughout this pandemic, and I've actually written quite a lot of pieces about this, which is how many high-income countries didn't learn from the successes of other countries. Look, this is a new pandemic, nobody's got it completely right, but there are countries that acted aggressively, quickly. You know, they did test, trace, isolate, support fast. They put social protections in place. They had good leadership. They had strong communication. They had presidents or prime ministers speaking to, you know, the public almost daily from their sofas, bringing people on board. And I think too many countries in the rich world just turned inwards. I mean, you know, the Deputy Chief Medical Officer in England famously said that the advice coming from WHO, you know, was really not for them, because Britain's health system would be fine. So I think there's a lot we can be learning, and I hope we can do better on learning from across countries on what worked and what didn't. In the interest of time, and carrying on that point about learning, in no way whatsoever am I mitigating or trying to pretend, you know, that this has not been awful in all sorts of ways. But are there also things that in the education continuity world should remain that happened? There have been a couple of editorials recently saying, actually, you know, for students with disabilities, or for, you probably saw the piece in the New York Times yesterday, for students of color, having hybrid or online has had some advantages. What are your thoughts about that?
I'd say from a larger perspective, one of the messages that I'm truly using with my staff has been marvelous through this entire thing, and the collective efficacy that we have built through moving through this whole crisis situation is enormous. And so, you know, often in education, we point fingers and we blame when kids aren't learning. And now it's, we did this. We can do more things for kids. You know, there's no reason why we can't get that kid who's struggling to reach high levels of learning. Let's figure it out. We figured out how to run school during a crisis. We can figure out how to get this kid moving and growing in a different way and supporting them in a different way. So I think the collective efficacy is huge. There's also pieces of that virtual world that we were hesitant to use in the past. You know, I have an example of middle school intervention. We had some assessment rates that said our 8th graders had some fractional conceptual gaps, where 40% of them or 40% of them were proficient. So that's not good enough, right? And so my math intervention is gamified in a virtual way, conceptual knowledge of fractions, where there wasn't a teacher with a kid, but the teachers gave feedback through this game process, and we reached 85% of our kids having the fractional competencies that we needed. You know, it's those kind of things that we've never done before because we didn't have to. So I think we'll take a lot from that piece as well.
Yeah.
I would add also that we're all well familiar with the challenges of virtual education, but the shift to online learning has enabled greater accessibility for some students and faculty members with disabilities. And so we really need to think about what are the key pieces that can enable greater equity and less ableism in our systems moving forward. We all know we want most kids in the classrooms, but there is an opportunity that we see across our learning environments for that.
I think I want to add just one additional thing to this, which is getting at the core of your question, Gavin, like what things could stay. And I think Libby and Anne hit on, you know, this huge pivot in education to, you know, moving completely virtual in the spring, to the decision making that had to happen. And so, of course, at the core of what the education sector is doing is educating children and helping them have academic success. And that is first and foremost at their core. But I think if we could somehow collectively really lift up all the other supports and resources and I mean, and needs that the schools address of kids and their families, and that had so much elevation and so much more importance as the pandemic hit, with school meal programs, with health services, with counseling and psychological and social services, all of these other ways in which those services had to be changed and turned upside down to try to still reach those most vulnerable students and their families and address some of the challenges that schools are used to addressing, but not in this way. And so I think it's really showcased how remarkable school leaders like Libby and other superintendents and principals and teachers and staff across the U.S., and I'm speaking just because of knowing our experience in this country, but I'm sure this is global. To me, it just showcases that commitment. And you don't go into education without a serious commitment to kids and their families. And I think I have hope that those types of services and supports and resources continue, and that education folks continue to look at them in a way of, okay, we're not able to reach these students who have these needs. What can we do? Like, it was this huge shift in thinking about how to make that reach and really truly meet the needs in totally different ways, that I think is going to stay, and I think continue to change and evolve in really positive direction.
That's actually a perfect, we are out of time, and that's actually a really wonderful way to end. Thank you so much. And it just leaves me to thank our amazing panelists, Sarah Lee, Anne Sostin, Libby Bonesteel, and Prachi Srivastava. And I must thank Jenna Smith and Dalal Najjar from CUGH, who have been absolutely spectacular on the logistics side. Thank you to the almost 150, 200 people who joined. I'm sorry I didn't get to everybody's questions. This has been recorded and will be available to everybody. Thanks so much for your time. Thanks again to the panelists, and enjoy the rest of your day. Have a nice day, as they say here in the United States. Bye all.